No, because we have to be on time. It's 7, so we should begin now. Okay. Good evening, everyone, and good morning to some other parts of the world. It's really an honor for us to welcome you all for the International Online Seminar on Indigeneity and Pandemics, Past and Present, Cross-Cultural Experiences. It has been a much awaited discourse which was needed not only among the indigeneity of certain continent, but among the indigeneity across the borders in different continents of the world. Therefore, this seminar was planned among different friends who are located in different parts of the indigenous world. And in the month of August, we started in the initial parts, we started planning it. And in a short while, we could schedule it as well. Not taking much of your time because we are already having wonderful speakers ahead to us. I now welcome all the dignitaries, especially Honorable Vice Chancellor Sir, Professor Dr. Pramod Yole Sir, who is Vice Chancellor of Dr. Babasaheb Ambedkar Marathwada University of Aurangabad. I also welcome Chair of our department, Professor Umesh Bagade Sir. Before I invite them on the dais, I'll just quickly say a few words about their coveted profiles, which is directly linked to the various aspect of this seminar. Honorable Professor Yaule is present Vice Chancellor of our Dr. Babasaheb Ambedkar Marathwada University, Aurangabad, India. He has done extensive research and has experience in scientific research and academic teaching in field of pharmaceuticals and healthcare. He was professor of pharmacology and principal of Institute of Pharmaceutical Education and Research, Wardha, of India, before being Vice Chancellor of our university. Our department chair, Professor Umesh Bagade, he is a noted scholar of of our Department of History and Ancient Indian Culture, School of Social Sciences, Dr. Babasaheb Ambedkar Marathwada University of Aurangabad. Professor Bagade has wide experience in teaching and research in field of subaltern history and history of Ambedkarite historical thought. He is a renowned scholar and contributed immensely to the caste histories and narratives. His various columns are published in several national level daily newspapers in Maharashtra and India, and he is a coveted scholar with many good academic books as well to his credit. I now request Professor Bagade to please take over the speaker's channel and further thereafter invite Professor Honorable Vice Chancellor, sir. Professor Bagade, please, sir.
I welcome Professor Yaule, our esteemed Vice Chancellor, for this important webinar. She is grappling with the contemporary development, particularly pandemic of COVID, and taking the past and approaching the present. I have read, I have learned about pandemics and world history through the important book of Browder, where he somehow takes a survey of the pandemics and epidemics shaping the history of the world. Largely, capitalism has integrated the whole sphere, where all parts of remote areas of world are integrated to capitalist exploitation. You know the whole system of colonialism, and through colonialism, the most part of world are integrated to this whole capitalist and imperialist order. Obviously, the kind of pandemics and epidemics started ravishing India has a certain kind of connotation of colonialism. We have baggage of colonialism, and colonialism has brought certain kind of pandemics and epidemics to India. You know the plague, which wasn't part of India when it struck to Europe. It never, in certain way, has ravished India. But particularly in 19th century, you see the different kind of pandemics and epidemics started shaping the history of colonial India. You know about smallpox, you know about cholera, you know about plague, you know about Spanish influenza that have changed the whole kind of structure of Indian history. And the whole kind of structure of colonial exploitation has a certain kind of linkages to this particular kind of pandemics. So certainly, we have to grapple with very important issue of indigeneity and pandemics. Indigeneity in certain sense is there in India and all parts of world which has their own subjugated knowledges. The people living in all parts of world are encountering, combating with several kinds of, we can say, diseases through their subjugated knowledges. For example, in places like Maharashtra, there are certain kind of people living in tribal, you can say, lives. They are having their own kind of perspective towards health. They have their own kind of perspective towards a certain kind of, you can say, diseases. They have a certain kind of perspective towards the nature. This has grossly destructed through the certain kind of exploitative structure which penetrated the remotest part of Maharashtra. For example, you know, the bills were you can see incorporated into exploitative structures where their lands were taken out, they were made as the wage begars and exploitation started taking place. So all such kinds of, we can say, policies which has given us to the imperial and capitalist order in certainly has destroyed the indigenous kinds of subjugated knowledge. And we, in certain way, has made onerous kind of project where we are making a global village where we have a certain kind of, we can say, hegemonic kind of structures which are operating. Uh, Foucault, Michel Foucault has in certain way has alarmed us about this whole kind of instrumental logic through which we are practicing our health. We are shaping our health practices. And this whole kind of structures of health practices, there is embedded structures of power which is shaping this whole kind of the health practices. So in Maharashtra particularly, you might be knowing that in not only Maharashtra but India, there was plague, and this plague was somehow governed through the colonial instrument. And the colonial instrument, there was a uprising against British because of their this plague administration. So one has to understand that there are several aspects to it. How we understand the disease, what are the ways we are somehow locating the disease, what are the ways we somehow are, we can say, inventing new medicines to combat it. There is this structure which is now taken up by the capitalist order. Now you will have to see that all kinds of diseases has certain linkages to a kind of a capitalist surplus appropriation which is shaping. In against this, one has to think about the alternative ways to look at health, alternative ways to look at epidemics, alternative ways to look at the world order. As we know that the whole kind of greed which is created by capitalism is in certain ways taking us to a point where there is a threat of destruction, there is threat of Holocaust, there is threat of its certain kind of delusion. So one has to understand that these particular epidemics are not only temporary implications, but are changing the whole history of mankind. If this is so, then we have to understand that there is a way to learn from indigenous kinds of, we can say, experiences, and that indigenous experiences can give us a certain kind of insight through which we can combat these kinds of epidemics and pandemics, where we will be definitely taking up the scientific path, which in certain critical way, as Foucault has explained us, that even this whole science and scientific rationality is subjugating the mankind, and we have to, in certain way, free ourselves from this baggage of power structures. So against this, I look forward to the discussions which will be taking place in this seminar, where there will be discussions on pandemics, there will be discussions on the indigeneity, through which, for example, the experiences of tribals and how tribals will be somehow articulating their own experiences, what way we can somehow have a certain kind of insight from that, what way we can somehow develop our own kind of alternatives to look at world. So this will be an interesting kind of opportunity for all of us. I'm looking forward to all of participants who will be presenting, and I'm glad that people from all parts of the world are representing in this seminar. And India, particularly abroad in India, are participating in this. So I'm looking forward. I will be participating, listening to all kinds of, we can say, panel speakers, and I will be somehow will be part of their discussions. I welcome our esteemed Vice Chancellor. I welcome all kinds of dignitaries who will be presenting papers and in the discussion. And I also welcome all participants for this seminar.
Thanks a lot, sir, for such an enlightening analysis of pandemics, especially through historical and colonial perspective. It was really critical to analyze at this juncture how Foucault and Braudel have analyzed the pandemics in past. And not taking much of your time, because these all issues we will be discussing as we will go ahead during the seminar. We now request Honorable Vice Chancellor Professor Pramod Yole, sir, to kindly give his welcome address, presidential address.
All the esteemed resource person from the country and abroad, head of the Department of History and Ancient Culture, our colleague, Professor Umesh Bagade, convener of the seminar, Dr. Bina Sengar, delegates who join online this seminar from India and abroad, invitees, guests, ladies and gentlemen. At outset, I welcome all of you on behalf of Dr. Babasaheb Ambedkar, Marathwada University. Today's online portal Google Meet is organized by the Department of History and Ancient Indian Culture. I must compliment the organizer for arranging this event online and on a very different topic, because since last 3-4 months, many webinars I am addressing, many I am attending. But first time, that is the indigeneity and pandemic, past and present, cross-cultural experiences on this theme. The Google Meet is organized. I must congratulate it. Friends, the world today is facing the biggest public health risk, which is leading to one of the largest and quickest recognition of the world order. The seminar is organized by the Department of History, and it is told that the history repeats. And if you see the last 300, 400 years, every after the 100 years, every after century, we are facing such type of pandemic everywhere, plague or the influenza in 1918, around 500 million people, that is the 1/3 of the world's population become affected at a time. And now 2020, we are facing this COVID-19. And because of this COVID-19, the epidemic has spread over to near about all the countries of the world and resulted in a closure of, particularly I am telling about the academics, 90% of the school and colleges and university, impacting close to 1.5 billion students. The speed of spread of the epidemic, as we know, the closure of the higher education institution and transition to online teaching was so swift that it hardly gave a time to plan and to reflect the potential risks or the potential opportunities that such a hidden change could bring. Given such a situation, it is important to look at the impact and reflect on what was aspired and what is likely to happen as we move forward in the field global scenario. Dr. Bagade has very nicely explained the impact on the in India, giving the example of Maharashtra and other states also of this epidemic. I will focus on the theme, though I am not an expert, but as an academician, what are my views on the cross-culture experiences and at a global level? The theories and research of individual coping and career transitions are of great relevance to understand the individual responses and reaction to emerging stresses associated with COVID-19 pandemic. As humans are cultural species, an investigation to this career implications of COVID-19 also become benefits from cultural perspective. Theories and research from cultural psychology help to explain not only the differences observed across the culture, but also the commonalities shared universally. Friends, in this online portal Google Meet, I think an attempt has been made by the organizer to adopt a cultural psychologist perspective to understand individuals' coping, self-regulation, and career management processes in response to the COVID-19 pandemic. A nation culture refers to a shared psychological meaning and collective practices that distinguish one nation from another. The shared cultural meaning have been operationalized in various ways, such as cultural values, self-constituents, thinking styles, regulatory focus, and so on. Given that members from the same nation are socialized to use their cultural specific orientation to guide their daily coping processes, there are significant cross-cultural differences in individuals' appraisal of stresses, choice of coping strategies, and indicators of adaptive outcomes. Therefore, it is necessary to know how culture plays a pervasive role in shaping the ways people assess and cope with the career-related stresses associated with COVID-19 pandemic. The COVID-19 pandemic emerges as a stressful and even traumatic event that requires individuals to make sense of the new situation and choose appropriate coping actions. Since cultural values reflect a desirable and end state that are worth pursuing, that are likely to influence members' attentiveness to and prioritization of stresses in the appraisal process. For example, in a country that values individualism, people tend from an independent, self-constrained and prefer to ideal self to guide their behaviors. This cultural orientation will direct members' attention to stress closely related to their personal and career development, such as job insecurity, difficulties of working from home and emergence of new career opportunities, and so on. In contrast, in a collectivistic culture, people's attention may go beyond their personal career development consideration to include issues related to their work groups, organization, and social networks. Based on different appraisal processes, the choice of coping strategies and their effect may differ, which will be discussed, I hope, in the today's this seminar. As individualism, self-constructuals and regulatory focus only represent limited aspect of cultural influence. Future research should adopt a more comprehensive framework of cultural orientation to advance existing literature on cultural differences in appraisal stresses. To cope up with the various stresses associated with COVID-19, individuals may choose to use primary control. As a student of pharmaceutical sciences, I can tell primary control directly solving the associated problem, or secondary control, for example, accommodating and reappraising existing problems strategies. The choice of coping strategies have been found to be shaped by national culture. For example, through comparing Japanese and American culture traditions and practices, found that primary control strategies are heavily emphasized in American society, whereas secondary control strategies are more valued in Japanese society. Evidence point to cultural differences in thinking styles also, which help to account of such Eastern-Western differences in coping strategies, specifically Easterns, that is Chinese and Japanese, are more likely to use holistic and dialectical thinking styles than Westerns, which are characterized by emphasis of context as determining forces, the expectations of constant change, as well as the tolerance of contradiction. Although the primary control strategies are generally preferred by Westerns, the holistic and directly thinking style give rise to the tendency of valuing the secondary control strategies and using both among the Easterners, which helps to explain the resilience and even the optimism of Easterners that facing difficult situations. In addition to its manifestation in individual orientation, culture is also embedded in nation's social system, collective actions and daily practices. As the COVID-19 pandemic is a threat to the nation's security, prosperity, and social order, collective actions led by the government and deemed as a crucial steps to overcome the emerging problems associated with it. In the discussion, we may analyze how the national culture influence the collective decisions making processes and how these factors may impact the members' behaviors. As we are observing since last 5 months, to cope up with the COVID-19 pandemic, many employees, such as key workers or essential workers, whose jobs are vital to public health and security, are expected to continue working. Those workers contribute to minimize the collective damage and securing the national interest at the potential expense of their own physical and mental well-being. In China, many health and medical professionals are deployed to support their peers in other cities. The excessive work stress and risk during the COVID-19 pandemic may lead to decreased self-regulation strengths or even the traumas. On the other hand, this work experience may also arouse a strong sense of pride and highlight the meaningfulness and significance of their profession. It may help also them building feeling of emotional bonding and connections with the peer doctors who fight side by side with them, creating opportunities for the new career skill development and future career opportunities to cushion the adverse effect of sacrificing self-interest for the collective good. Government and social institutes should take necessary measures to protect key workers' occupational safety, recognize their contribution, and support for the recovery from the excessive work demands. Friends, since every member has a multiple cultural identities, they may identify more with their ethical culture, professional occupational culture, or religious culture instead of national culture. The complexity of social identities and varied levels of culture identification may lead to the risk of intergroup prejudice or even conflicts within a nation. For example, people who identify with a certain cultural group may pursue other groups as a threat, leading to intolerance and aggressive behaviors against the other group, which may further escalate into a large crisis. Governments and social institutions should seek guidance intergroup theories to effectively prevent these incidents. Previous, in the last that it is possible to shift members' representations of group boundaries and guide them to include another group into a more inclusive and superordinate group. Friends, this COVID-19 have taught us many things. Since last 5 months we are facing it. The COVID-19 taught us the humanity. The COVID-19 taught us that though the science and technology is developed, but definitely the human development or the human brain is having the limitations also. While as Professor Bagde also touched to that is the indigeneity. What we Indian are observing in the last 5 months, our Indian culture also help us to face this pandemic. Our yoga and meditation also plays a good role or important role to reduce the mortality. Even at present, the recovery rate is around 70%. Our Ayurveda and herbal medicine, since I'm a student of pharmacy, definitely I am proud of this Ayurveda and even allopathic medicines also. They are also, particularly Kada, that is some mixture of some herbals like Osimum sanactum or other aromatic plants. They are also, we Indians are taking instead of a tea and all coffee, and definitely it is giving a better results. So I will not take your much time. I'm thankful to the organizer, especially Dr. Bina Sengar, who is continuously behind me since last 18 days and was requesting me to attend this seminar and guide us. And I welcome all of you on behalf of the university again. And I declare that this online portal, Google Meet, or you may call it as a webinar, is inaugurated, and hope that the fruitful discussions will be there, deliberations will be there, and we can focus on the theme of this conference. Thank you for a patient hearing and giving me an opportunity. Thank you very much.
Thanks a lot, sir. It was truly an honor to have you with us. And you gave a different dynamics, because not only you talked, you discussed about various components related to pandemic and the challenges which it has given us in the contemporary times, but you also brought into light the further hidden challenge comes with the pandemic, lockdown, and different lifestyle changes, which are giving a chance for us to reevaluate how our life is heading towards, and what are the different, what we could say, response are going to happen because of this. It was really nice to have you, and definitely we'll make it a point that what all suggestions which you gave, we will be discussing them during our seminar. And we'll try to make as much efforts to have a cross-cultural dialogue, which is actually the main objective of this seminar, where we will try to highlight into what all challenges and how the response is happening among the indigenous communities globally. It was really an honor to have two distinguished authority members of authority chairpersons of our university, Professor Bagade, Chair, Head Department of History and Ancient Indian Culture, and our Honorable Vice Chancellor, Sir, of Dr. Babasaheb Ambedkar Marathwada University. With their permission, with the permission and inaugural address of Professor Yole, sir, we now have this session formally open for the international seminar, or as he said, as this webinar. In the beginning of this, as we already began with the inaugural session. So first I must thank the dignitaries and all the panelists who took their time from their busy schedule today, because today is only going to be a section 1, but we had other members of different panels as well today who became part of the inaugural session and contributed their valuable time. And also during the informal session, we had some informal interaction among the members of this webinar. I once again thank, and with that, we end the session 1, that is inaugural session, and we'll begin with session 2. As we know, the session 2 is about visualizing past colonial epidemics, turning into pandemic now. So this particular panel will have 3 speakers. Unfortunately, 2 speakers only. As per the schedule, we had 3 speakers, but somehow because of his own personal health issues, Professor Sugam Anand cannot join us. So the 2 panelists for this session, Visualizing Past Colonial Epidemics, Turning Pandemic, we have Dr. Maria Luisa Vaisaga and Dr. Miguel Reyes Contreras. Professor Maria Luisa Vaisaga is from Florida International University, Miami. And Dr. Miguel Reyes Contreras is from University of Mexico, Mexico City. I'll briefly introduce them. And for the discussant of this panel, we have Dr. Paramita Ghosh. And the reporter for this session will be Mr. Ojas Borse, who is a PhD candidate for our department. I'll briefly introduce, now I would request Professor Maria Luisa Vaisaga and Dr. Oh no, you don't have to come. I request Dr. Maria Luisa Vaisaga and Dr. Miguel Reyes to kindly open their cameras so that they will be visible. And also I would request Dr. Paramita Ghosh to join the panel. I'll briefly introduce their prolific profiles. Dr. Maria Luisa Vaisaga is going to present on indigenous communities of South Americas in the times of COVID-19. She is a woman of multifaceted talent. She is a scientist who works extensively in phytochemistry as well as in the biochemistry issues, and she is working on various herbal practices as well. Along with, she is director right now of Indian Studies program at Kimberly Green Latin American and Caribbean Center of Florida International University. Maria Luisa has extensively worked on social welfare, academic discussions on both. She is a perfect combination of scientific as well as humanities research. We have with us Dr. Miguel Reyes Contreras. We will be speaking on Where Are We? Visibility of Indigenous Peoples in the Public Discourse of Pandemic. So he's actually going to highlight on the silence, which is we can hear about, which is loud enough than the silence itself, which is there about the indigenous communities and how they are getting affected because of the pandemic and the subsequent lockdown. Dr. Reyes is a professor and researcher at Universidad de Ixtahuaca, which is CUI, Mexico, and he is professor of English language department over there. He's an associate professor at the Institute of, he was actually a Fulbright fellow at Institute of American Indian Arts in New Mexico. He belongs to Majahuan indigenous community in central Mexico. His main areas of studies are in the linguistics areas, onomastics, place and persons names, paremiology, proverbs, phrases, etc., discourse analysis, teaching methodologies in cultural studies related to indigenous people in Mexico. Most of his work is related to the study of minority languages landscape in New Mexico and New Mexico. Interdisciplinary discourse analysis, CON, and its relation to proverbs and sayings in Mexican Spanish, and methodologies for language and culture teaching. These are some of his core research areas. He's a member of ONOMA, a Seminario Inter-Institutional de Onomastica, and is a member of the Mexican Linguistic Association. He's currently studying the presence of minority languages in the New Mexican toponomastic landscape and settled in Santa Fe, New Mexico, which he began, the research he also took as a Fulbright visiting scholar at Santa Fe, Indian Institute of American Indian Studies. So I welcome both our scholars panel, and I will also welcome Paramita to be there. Without taking too much of your time, because we are already heading towards it, I now request our first speaker for the panel today, Dr. Maria Luisa Weisaga.
Thank you very much, Dr. Sengar, for organizing this really important and timely discussion seminar on the impact of COVID-19 in cross-cultural experiences. My warmest thanks to the Department of History and Asian Indian Culture for hosting this dialogue. And I'm very, very, very grateful to be here in this virtual seminar and learning from other speakers and their perspectives. Thank you, everybody, for being here. Can you hear me all right?
Yes, ma'am. Yes, Damel, we can hear you very clearly and both ways. Your audio and video both are fine. Perfectly excellent.
Excellent, thank you. So how do indigenous peoples in South America cope in this time of COVID-19 pandemic? My reflection today will be specifically related on peoples and communities in the Andean region, Andes region in South America. And here I will take 4 seconds to make 4 points about the nomenclature I'm going to use and from where I am talking. To begin, from the onset, I would like to emphasize that I don't speak for or on behalf of all indigenous peoples. Instead, in this case, my role today is to share some situated knowledge, mostly from close experiences and networks I belong to. Although for the purpose of this presentation, I will address the peoples and communities as indigenous, I would like to clarify that most of them identify themselves and their communities with their own names. And that is Quechuas, I am a Quechua, Aymaras, Huichis, Guaraníes, Mapuches, Runas, Pueblos Originarios, Ayllus, Marcas, Nation, Comuneros, and so on. There are lots of more languages spoken. Also, when referring to specific communities, I will address them by their own name. And also to end, from that point of view, South America is known as Abya Yala. Making those points, we know historically that indigenous peoples prove their resilience over time. They have gone through epidemics before, and even efforts of genocide to the point of extermination. As in the case of the genocide Argentine military campaign, Conquest to the Desert, that in 1870s, in the 1870s, was intending to exterminate all indigenous population located in the half-south part of the country. Nowadays, they have been deeply and disproportionately impacted by COVID-19. Several factors are affecting the vulnerability to the novel coronavirus with devastating results. The long-standing impacts of colonization, historical and systemic inequities, racialization, discrimination, phenotypical and to languages, poor economic conditions, and fragile access to healthcare systems have contributed to social disparities, making them face several internal and external challenges. Although the state nations where the indigenous communities are located have approached them a type of relationship with indigenous peoples based on the recognitions of rights, respect, cooperation, and partnership, we have to acknowledge that the actual realities and challenges they face, which is a historical legacy of neglect, to the indigenous communities that make COVID-19 a particular virulent healthcare challenge for them. Just to situate us, when we talk about indigenous peoples, we have to consider the indigenous communities, the ones that they are in voluntary isolation or initial contact, the transboundary communities, and the peoples of original communities that they are living in urban centers. They are dispersed in the vast geographies of the land, located in high altitudes and the valleys and the lowlands, in the plains, in the Amazon, in rural areas, and in the crowded cities. Some of them, they only speak their languages. Some of them, they speak 3 languages. Some of them, they lost their languages, and they speak the national language that in South America, except in Brazil, it's Spanish. Indigenous languages are not well seen through the state nations. So most of them, they assimilate and they speak Spanish. Also, we need to realize that these groups are not homogeneous. They have their own way of doing things. In many things, they have their, like I said, their own languages, their own philosophies of lives, their own religion systems. Some groups, communities, nations are highly politicized and others are not, which is central to understand them. Another point to remark is the rights that their rights as citizens depend on this and laws of where they are located and belong to. They are definitely not independent states. So pre-COVID-19, indigenous peoples were held under many of the worst environmental and human rights abuses. Before the pandemic hit, they were suffering the same things, and now they are their conditions. COVID-19 found the different indigenous communities vulnerable and facing situations of racialization, poverty, falling behind all the indicators for development, with less security, lack of access to relevant information, lack of access to clean drinking water in many communities, lack of limited access to healthcare services and medical supplies, higher rates of underlying medical conditions, higher rates for new external infections, not having people who really speak their language, and in the cities, high levels of overcrowding, living in intergenerational, problematic sanitation, ongoing human rights and environmental and territory violations, some more likely to be food insecure, with degradation of natural resources due to industrial activities, and with climate change consequences that affect them all. Before COVID-19 hit indigenous peoples and their communities, some groups were also struggling to protect their lands and territories from dams, oil and mineral developments, big extraction projects, big, large agricultural projects, and also put them in a position that make it more difficult to respond to COVID-19. Or selling fruits and vegetables in the markets, or goods in the streets, or working as cleaning personnel, underpaid, understudied, underprotected. In times of COVID-19, regarding the cases, recoveries, and deaths from COVID-19, one point to consider is that COVID-19 happens, communities located in lowland areas are already struggling and facing different types of epidemics, such as malaria and dengue. Regarding recoveries, the deaths, we need to highlight that there is very little reliable data, and we don't have statistics for indigenous peoples and their communities. No one government in South America can provide disaggregated data when they refer to cases about indigenous communities and indigenous peoples. The data is scattered, most NGOs, some governmental organizations, and they are mostly comes from Brazil. And for the other ones, there is some data, and if there are, the statistics are not clear at all. We have to realize that the statistics and good, these aggregated statistic and information about these communities is necessary to understand the cases across South America, how they report the cases, and how to break deep the invisibility of indigenous systems, and also to understand the multiple ways of reporting and the complications. So for these communities, we don't have active figures of positive cases of COVID-19, not the deceases or the recoveries. This is an important point in terms of how we are going to address the impact of this epidemic and also the aftermath. With very little data, but the one that exists, there is a disproportionate effect of this epidemic on indigenous people, both in number of cases and in death. And also sometimes when there's a relief money or relief things, they don't go to the indigenous communities because they don't exist. They go to other peoples that we know they need it, but not to the communities. At the same time, we have to realize that this COVID-19 emergency generates effects, social effects and economic effects, some urgent as the health ones. Across the communities of the region, there are reports of shortages of food. In the case of the Wichis in the northwest of Argentina, Tobas in the northeast of Argentina, Guarayos and Guaranis in the west lowlands of Bolivia, Mapuches in the south of Argentina and south of Chile, some Quechuas in Peru, and also in Bolivia. There's shortage of medicine, lack of access to information, and also lack of access in the traditional languages, in the languages they speak, and absence of government support in addressing the crisis. What we are seeing, there's more instances of human rights violation, increased discrimination based on physical traits such as phenotypes and skin color. Also, lockdown have been used to continue invading indigenous territories, their land and their natural resources. In some cases, the situations have been used to intensify armed conflict and to criminalization of indigenous right defenders. As in the case of Mapuches, communities in Chile and in Argentina, they are facing high concentration of cases of COVID-19. And also, same thing as in Colombia. There are several communities leaders that have been killed. And at this moment, also Bolivia is going for a big turmoil regarding the next elections. So the survival response, so how they are coping with that. At the same time, the indigenous communities in South America are fighting back as always. They are stepping up to provide support to each other, to better protect themselves where governments have not. They are taking specific measures, increasingly seeking their own solutions to the pandemic, in their own ways to protect their people. They have their own warning systems established already, not only for this pandemic, but for everything. And now more than ever, they are being activated. For example, in the High Andes, we have this word called INI. That means we have to help each other. They have been taking actions. So the different communities, they have been taking actions at the community level using traditional knowledge to help prevent the spread of COVID-19. They are developing their own protocols for keeping it safe. Some communities are sealing their territories as measure of protection. They're practicing voluntary isolation or trying to isolate, imposing sanitary barriers. Although in a lot of cases, example, isolation for peoples who live nomadic lifestyles herders of lamb, llamas, goat herders in Malargüe, Chile, Argentina, and the north of Argentina. And COVID-19 is a challenge for their lifestyle because of the lockdowns. Another example is the case of Ecuador. Sociopathized indigenous elders, adults, and children travel deep into the forest to their ancestral heartland, to Lagarto Cocha, which means the lake of Lagartos crocodiles, to escape exposure to the novel coronavirus. We need to highlight that isolation or sealing of communities is nothing new to indigenous peoples around the world, and it's a way to protect their members during a crisis of after a tragedy. They are also implementing preventive measures in their own languages. As I said before, usually if you are not in the community and you are in the city, you keep for yourself the language. There are languages that you only speak at home. The school systems, some of the countries, they have bilingual system, but not all of them. And also, they don't have the same prestige as the national language. So they are, regarding the languages, they are ensuring that the information on COVID-19 is available in their own languages. Many leaders and organizations have issued guidelines and public service announcements in their own languages. Local network of indigenous community radio stations located in areas of indigenous populations are translating messages and guidelines in their own languages. It's important the role of youth and first year college students or high school students, because they are helping a lot about translating the national discourse, the medical issues the government said. And also the radios, because not everybody reads or they are literature. So, and also they activated resources for the daily needs. For example, Mapuches in South Chile are seeding before times with winter seeds. And also there's a dynamic exchange of seeds. They have created in all the Andes a circle of internal economy in order of not to go to the cities. There's a lot of seed exchange and good exchanges also. Regarding health, the communities have their own health and knowledge systems. We have to remember that. Plants, song, dances, ceremonies, prayers to heal as a prevention and or to heal the body, mind, and to recover physically, spiritually, and emotionally. The communities have relied on medicinal plants and herbs as prevention strategies to remain resilient. And some of the communities have their own manual of medicinal plants already. Let's remember that a big percentage of the medicines that they are being developed have developed by Western science. They come from traditional medicines. For the traditional knowledge of the elders, the mothers. All these survival efforts to keep safe in times of COVID-19 are carried out by all members of the communities. So when we talk about indigenous, we are talking about women, men, elders, kids, children, to protect themselves. The priority is protect the elders using, like I said, the medicinal plants, ceremonies as part of preparing.
Thanks a lot, MLV. I think, Paramita, can you join me? We are really fortunate today because of the inaugural session, lots of other panelists are also there with us. Paramita, can you join us? So I'll introduce you to a few more members. We have Dr. Thakur Patel, who is Dr. Patel, can you come online with your camera? Dr. Patel? Yes, that's great. Dr. Patel is working with a project on Sevak Foundation in Guyana. I think it's French Guyana. Dr. Patel, if you can enlighten me in that.
British Guyana.
Yeah, Guyana. So there is an echo in your mic. So I think we have time because I think Paramita is joining us here. Yeah, Paramita, you there? So we can, I really appreciate because Maria, you brought MLV, you brought some really interesting aspects about, I really like this idea, this concept which you raised with us is there is a terminology, if I'm please apologize with my linguistic limitations with Spanish, legados, which is like going deep to forest to survive pandemic. This is the response strategy of indigeneity on their own. And they have their own methods of spiritually, mentally, and physically healing. You may not believe, but even in the most urban areas in India, people are working with that. And Dr. Patel is actually working on this whole lifestyle healing practices as well, especially in the different indigenous communities of India through his project. So we have time. Before we begin with the second presentation, we can have a nice discussion on this theme. So we have Dr. Jean is there, Dr. Patel is there, Dr. Wiedmann is there. So if there is any question, I would really appreciate that because especially to comment to the presentation of MLV, Maria Luisa.
Hi, yeah. Maria, this is Dr. Patel. Can you hear me?
Yes.
Okay.
Nice to meet you, Dr. Patel.
We set up this project in Gujarat. I'm going to be talking about this project tomorrow in extensive fashion. The project is where you train a local person, and you have referred to it several times. But how do you maintain it long term? COVID is not the only one. COVID just happened today. For example, we started this in 2010, and we call them sevaks. These are people who live in the village. We train one of them. Depending on the size of the village, it could be one or two. And then they go house to house and do health screening. In our case, we took blood pressure and diabetes because the village people are never screened for these things by the clinic or government or anybody. And looking at it, it's quite expensive to do it. For example, the strip in India costs 25 rupees. In United States, it's $1. So, but we do the screening. It empowers the local person that you have trained into healthcare. They do not deliver health. I mean, they do not deliver medicine or anything else. They refer them to the local government clinic. And in India, they have what you call ASHA workers, which I'll refer tomorrow again. And they refer them to the ASHA worker who has about a couple of medicines, diarrhea, fever, things like that, malaria and all that. And this program, since 2010, has worked really well for us. And I was able to transit to COVID also. Basically, this was downtime, 3-4 months. We give them a stipend, but told them to go and get training on COVID. Fortunately, the Indian government has put this program online. And I think it's accessible to anybody, anywhere in the world. It's in English plus all the regional languages of India. So if you want to look at it, it's available for anybody. And so we had this sevaks get certified by that program. And I think that's the way to go. Now, next year, I'm going to get them trained in disaster planning. So these sevaks are like blank check. You write what you want to on them. Some of them are running water plants, reverse osmosis water plants. We put in a sanitary napkin factory. The sevak runs it. We put in a sewing center. The sevak runs it. In addition to what we gave them before. That doesn't change. And I think getting somebody like this at the lowest level works really well for us.
So Maria, what do you have to say?
Thank you, Dr. Patel, for your input. I think these are great ideas, and as I can see, they can, share and put in others. I think the issue in the different countries in South America, depending on the countries, because we are talking a lot, different countries, is sometimes that happens in some villages, but not in all of them. So it's like if you have a road, it happens to the villages by the road, and sometimes some villages, a little further, but not in all of them. I'm going to bring here also different countries. They have a high problems with corruption, and also there's always these size, the national government plus the NGOs. So there are so many. Usually when I say that, people say, oh, we have this in such and such community, we have this and such community. The problem is not all the communities have the same access. Not all the communities in the same country have the same access to the person or the hospital, and not all the countries have the same views of how to take care of the population. Plus, there's one thing about not all rural communities are the same. And I think you already know that. But I'm going to check on, I guess, Bina will provide the email. We can check on that and, and see how we can learn from your experience.
Definitely, that's good. Just let me unmute you. Let me unmute you. Yeah, please. I'm sorry, just to avoid the chaos of the.
Maria, this Sevak project is an offshoot of the U.S. Navy's Independent Duty Corpsman program, medic program. It's not like my invention, but I was the director of surface medicine in the U.S. Navy. And I said, how can I help villagers in India? And that's where I took the curriculum, and I was the director. Being director, I said, I could just take this program, put it in a village. Village is like a Navy ship. Population is contained, they're not going anywhere. But it is important to get them because that population is very vulnerable. Now I'm looking at how to bring that Sevak project back into United States in the Native American communities and the inner city areas. That's where, even in United States, we need that same project. So it's like full circle. We put it in Guyana, South America, and it's still working there. And they also need a lot of help. For example, in just basic healthcare. So a lot of the indigenous populations around the world could benefit from something like this. It's low cost, it's not very expensive. And sometimes I hope government will just take it and say, we will do it. Because that's what is needed. In India, a lot of people promote that we need more doctors. You don't need doctors in villages because what are they going to do? And even if you put them in villages, they'll run to the city, keep their family there, and will commute to the village, which doesn't serve the village population. So it's important to get somebody who is local and keep training them.
Bina, I might say something for
Good
Native
point. Thank
North
you.
Americans. Bina?
Yeah, please do. Let you're unmuted, right? You can, please, sir.
Yes, for Native North Americans.
Yeah, please.
For many decades, since the early 1900s, the federal government set up Indian Health Service hospitals and healthcare systems. The hospital systems are diversified across the United States in various communities. I'm very familiar with Oklahoma. There's actually 6 hospital systems there. And so very early in the 60s, later 60s and the 70s, they developed a role called the Community Health Representatives, CHRs. And so that became a widespread throughout the different Native American tribal communities in the Navajo and the Southwest. And it developed differently, for each tribe because it was so different. Locally adapted, and the kinds of individuals that would be service information providers. Also, not only bringing information, but also transportation. And so that model, I believe, has been with the U.S. for some time. But how it is working now, I can't report on that.
Oh, just a second. Yeah. Thank you, Dr. Wiedmann, for this insights. Because as Maria Luisa was talking, she discussed in her presentation about what are the challenges which are there in the healthcare services in the South America, especially in context of Colombia and some of the northern nations within the South America. And secondly, this is like the inner communities and the indigenous communities, which are living in the deforested areas or which are a little cut off from the mainstream town and the settlements. They do have this limitation of getting connectivity. I was just discussing with Paramita also in the evening today that even though that's part of my personal experience, because my mother and my maternal grandmother, she gave birth to 14 kids, and out of which 9 of them died because of different epidemic issues. And even though my mother's village is only 15 miles far from the main, very important town in northern part of India, the healthcare system was neither accepted or neither was so much accessible for the villages of my mother. And this is a kind of a limitation we continue to have even today in different parts of the indigenous population throughout the globe. So as you could see, Dr. Patel discussed about the, imagine in 2020, we are in desperate need of a project like SEVA, which Dr. Patel discussed about, not only in India, but even in South America, very much. And now he's talking about coming full circle that even America, United States need it. So where exactly we are failing in terms of pandemic management and healthcare? This comes as a very important question. We have another 10 minutes for MLV's presentation, just for a while. And then we will begin with Miguel. So I would like Paramita to give some of her insights if she has, because she's the discussant and she has her own observations to share.
Actually,
just shift yourself because your only eyes are visible. Okay, perfect.
The first thing is not an observation as such. It is a question actually to Ma'am Maria Luisa Baisaga. So what you have said is actually quite similar to what we are experiencing in India, or even actually the chair of the United Nations Permanent Forum on Indigenous Issues, and Inaugural actually has said those things, highlighted those things that you have also highlighted in your paper. So she also has been saying that this coronavirus pandemic is a threat to the indigenous people. And because they have least access to healthcare systems, to essential services, to sanitation, to anything. Actually, even the COVID-19, these things that those can save them, like water or disinfectants or soap, like these things. So they have, in this way, they are already marginalized, and they have been by this coronavirus situation, pandemic situation. Women are getting more vulnerable because they are at times the primary providers, and these facilities should be available. This is also what this say. Actually, you have also highlighted the same thing, that is actually the same. So what we have right now, what actually comes out as a question to me, in India, we have the issue of migration and reverse migration, because you have highlighted one thing where they are practicing their own indigenous ways to protect themselves. The United Nations Common Forum, they have also highlighted this thing, ma'am. So they are using their traditional knowledge worldwide. Like they are blocking the territories, they are having voluntary isolations like that. So, so medicines also they are practicing. So in that way, this migration and reverse migration is actually posing a great threat, because I come from Tripura. I was born and brought up in Tripura. I was not born and brought up in West Bengal. So Tripura is the home to a lot of diverse indigenous tribes. So the situation there or in Bengal also is quite the same. The migration and reverse migration is affecting indigenous tribes more in this situation today. So do you have the same problem over there? So how are they isolating themselves if the migration and reverse migration is happening there over too? This is the question now.
Paramita, that's such a good point. And I think we were talking a little about this before we went live. What I saw, the social networks and also all of us, we are there, what's going on. I see something really interesting that's happening in the high altitudes in Bolivia and in Peru. So they have created safe houses, and this is how it works. I'm talking about small villages. So there's the village, there's the city, and people are coming, and these are their own family, these are their own. So some communities, they have these called, it's a Quechua name, but it's a safe house. So they come to these houses and they stay there 2 weeks. And people they come with foods and goods from the city, and they leave it in the middle of nowhere. And the people from the community, they leave it there, they pick it up, they go, and there's a middle point or some points where they go and they leave water, food, until they are safe or not. And then once the 2 weeks happen, they can go into the community. So this poses a threat, like what happened with that people, they don't manifest symptoms, or some, even using that technique, some villages have been affected. So, and there are other villages that they say, no, this is it. No one is coming from the outside. And if someone is leaving, there's no point of return. And I can really understand why they're doing that, because some villages are being devastated. Some, I said before, part of my family, they've been highly, I'm sorry, getting emotional, but we have to think, and they are thinking, and we are thinking from different places how we are going to stay alive. And that's the thing, how we are going to stay alive. So I saw that in Peru and in Bolivia, this concept of half safe, like safe house, which I think it's working for some of them. But I'm talking about high altitudes, it's really cold, so the food doesn't go bad immediately. And in lowlands, it's hard for me to talk about because I'm not from there, and my family is highly from high altitudes.
Paramita, would you like to sum up something from presentation of MLV? So then we can proceed with Miguel's presentation. And once the Miguel's presentation will end, then we will have again a panel discussion on linking these two aspects about indigenous health systems and because MLV also raised some issues related to language and the identity and the service provided during the pandemic. So Miguel is going to talk about something that, and then we will integrate both the panels. presentations, and we'll have another Q&A session after the Miguel's presentation. So, Paramita, would you like to sum up something for this session? That what all discussions and questions we had?
Yes, the question was very rightly and just in a very logical way answered by Maria Luisa Vesaga. But the thing is, there are a lot of issues that are coming up right now. And we will, of course, we have a common panel discussion later also that we can, because Maria already has said that she is not representing all the tribes, all the indigenous tribes in the world. So that is what we are trying to explore in here. That what is happening in the corners of the world, whatever corners we can explore right now. So yes, what Maria has said in this lecture right now, actually it presents or represents the situation worldwide a lot. Because this is, as I had been reading from United Nations Permanent Forum for Indigenous People, it reflects a lot of things that they have said. In fact, the same as there is no recorded data. Either the data is not being recorded about the infectious rate, the rate the infection is going among these tribes, or the ethnicity is not recording this data. It is the same everywhere. Even in Tripura or even in Bengal, it is the same. That is what I can see, what Maria has said. So yes, what she has said, although she just has rightly said that she does not represent all the tribes, but yes, her lecture and her observations, these observations cover the worldwide situation a lot. This is the situation regarding indigenous tribes, more or less. It is the same. So it was a beautiful lecture. It covered a lot of pertinent points. And yes, there are lots of issues and there are lots of points, questions coming up that we'll address later in a combined way, I hope. So
sure, definitely. Thank you, Paramita. I now request Dr. Miguel Reyes-Contreras to present his work. Title of his presentation is Where Are We? Visibility of Indigenous Peoples in the Public Discourse of Pandemic. There is no doubt, I'll just read his abstract because I think it is going to benefit you all. There is no doubt that the worldwide situation is putting some social groups on the spotlight, but some more than others. Indigenous groups in Mexico have been affected in a stronger way than the rest of the population, as they belong to poor or isolated communities. In this talk, the different indigenous groups from the central part of Mexico are presented, and some examples are provided about how these people are represented in the mass media, in some social networks, and in the official discourse of the government. In contrast, some example of how these people are facing the pandemics will be provided. So I welcome Dr. Miguel to kindly give his presentation and enlighten us more about the indigenous issues in Mexico.
Thank you. Thank you very much for the invitation. I'm testing my audio. Can you listen to me?
Yeah, you're audible.
Okay.
Your audio and video both are perfect. Excellent.
Thank you. Okay. Well, I would like to thank for Maria Luisa's presentation, because it's something really related. I was taking notes, and some aspects are related to what I'm going to talk about in terms of abuses that indigenous communities have suffered. And I want to make a break in this, in saying that there's also this terminology in Mexico. People are decide to be called indigenous, no, indigenous people, but they also call themselves as their own name in their own language, and that's what I'm going to start with. I'm going to start talking about the indigenous people in the state of Mexico, in the central part of Mexico, then the visibility in the social media and newspapers, and then the reality. So in the end, my abstract changed a little bit because I interviewed some people from the local communities, how they are facing it. And there is something that is different to what I thought. Okay, so if you allow me, I'm going to start. I'm going to share a presentation.
Yeah, just try sharing it. If you can share it, it would be nice. Hello. Yeah. Yeah, Miguel, can you share it?
Yeah, I'm doing it.
Yeah, just try to do it because you just have to go to the present now, and from there you will be able to do it. Yes, that's good. Okay. Just a second. Yeah, let me see if you can present it. Yes. So can you put it on the slideshow mode, F5? If you want, you can present it this way as well, but it would be better if you can put it on slideshow mode.
Okay, you see my presentation?
We can see your presentation, but it's not in slideshow mode. Otherwise, you can just leave it. If it is inconvenient, then we can look at that way as well. Dhanraj, can you help us out? The presentation is visible on the live telecast. What I should remove? Yeah, he's presenting, but my question is it there visible on the live? Okay, perfect. So I need to pin his presentation, right? Yes. Yeah. No. Can you do it again? Miguel, can you do your presentation once again? Just click on it again. Through present now mode. You just have to go to Google Meet. Yeah, below you have this present now column. Okay. Could you do it?
I don't think you can see my presentation.
No, I can't actually. What do you, otherwise, can you see there is a column called present now? Yeah, towards your right, down below, there is present now. You have to click on that and then do it. I think you just missed that. Yeah, let's do it again. Okay. Otherwise, you can send it to me by WhatsApp and I will show it if that is there. Thanks. Just a second, let me unpin you probably, then we may be able to. Yes, now it's coming. Yes, now it's coming. Perfect. Yeah, perfect. Go ahead. Yeah, go ahead. Miguel, you can start. Yeah, just unmute yourself. Miguel, just unmute yourself. Yeah, I'll unmute him. Let me see if he's unmuted. Miguel, okay, perfect. No, he's not. This is his presentation. Miguel, can you unmute yourself? Miguel, you have to unmute yourself.
Okay, so this is
Yeah, now it's better. Yeah.
everything. I'm saying TV on the quick
your voice is a
I'm
little.
greeting you in the 5 languages spoken in the central state of Mexico. And first of all, as Maria Luisa was explaining, this linguistic diversity and cultural diversity that comes attached to a language can be seen in the terms of epidemics at the beginning, when there was an extermination of linguistic groups when the Spanish arrived to America. Well, nowadays, I know that in England, in India, there are many indigenous groups. In Mexico, we have 68 groups and 364 linguistic variations, which are distributed in mainly in the south and in southeast part, and also in the north part of Mexico. And these languages are, as you can see in the center part of Mexico, we can have some of the most representatives. These ones, this is the state where I come from. This is the state where I live in, the state of Mexico, which actually surrounds Mexico City. And in the state of Mexico, where this is the capital city, which is a very modern city, but it's lots of indigenous people live here. So we have 5 groups in the state of Mexico. The Mazahuan group, which are called themselves Ñatjo, also the Otomi, the Ñañú, the Mazahua, which are actually called Mexicano, and which is the indigenous group where the name of Mexico comes from. The Matlatzinca, they are called the Botuna or Fotuna, and the Tlahuica Piecacjo. They're distributed in this state. As I told you, this is Mexico City, so we are really close to the capital city. And as Dr. Patel was mentioning, Dr. Bina was saying that they were really close to a big city, but the medical services were not as good as they would like to, and they were just some miles from the big city. So the same happens in this part of Mexico, because as we have 43 municipalities, indigenous municipalities, 13 of them are Mazahuas, 21 of them are Otomi, 11 are Nahua, 1 Tlahuica, and 1 Matlatzinca. And the most representative municipalities is this kind of belt in the states, which is San Felipe, San Jose del Rincón, San Felipe del Progreso, Temoaya, Ixtlahuaca, that's my hometown, and Toluca, which is the capital city. So in this belt, which is really close, well, this is the capital city and it's really close to the national capital, it's really populated by indigenous people. So this is the distribution. So I belong to the Mazahua group, which is the most numerous group in the state. And I would like to talk a little bit about these groups, because this is important to understand how they are facing this problem. So we have first the Oquilteco, because this is the least numerous group, with only 700 speakers, and they are called by themselves Tlahuicas. The researchers call them Oquiltecos, but this is not accepted by them, because Oquilteco means worm eaters, and it's a very pejorative term for them. But they call themselves Piecajo, which means as we speak. It's a self-denomination of people in the language in this group. They are located in just one municipality in the south of the state, and they are. This is also important because they have very important rituals and symbols, which is this tlatol, which is a teponaztle, which is this kind of drum. It's a wooden drum, and ñexo. This is the most important part, because they go to the Zempoala forest to collect fungus or mushrooms, and this is important for their economy, and this is what is keeping them nowadays sustained in this situation. The Matlatzincas live in a very nice forest in San Francisco, Xochitl, Temascaltepec. It's only one community, and meaning the net fishing people, which were 3 or 4 centuries ago, they belong to the area of Toluca, in which now the capital city is, and now it's a dry lake, and where they used to fish, and that's why they were called the net or the fishing people or the green people, because they live of fishing. But now the dry lakes have forced them to move to the mountains and live into the forest. Okay, and this is the most numerous group in the country, not in the state. It's they live in 11 municipalities, and this is the most important group in Mexico, the Nahuas. It's about 2 million speakers, and which was the dominant group when the Spanish arrived, and that's why most of the names are preserved, because they were the empire. Then we have the Otomi, which is located in this in the center of this land, the strip of land in the state, and they are also called themselves by their own in their own language, the Ñañú, or the ones who speak, which is the people, or they were called themselves the people of the arrow, because they were hunters, which nowadays has been nobody hunts anymore, because forests have been devastated by industry. And this is something of the symbols of the Otomi, which is the tlequil of the furnace, which is a family gathering place where people get together to tell stories and also to share traditions, tales, and where they honor their gods, the earth and the moon. The most important symbol for them are the clothing, and because they like to show off their embroidered skirts, which are called enaguas, or these are the quisquemet, the sarapes, which are called in Mexico, they're called rebozos, and this is the most traditional handicrafts, the baskets and the dolls. And finally, the Masawa, which is the most numerous groups. As I told you, it means the people of the deer, and it's more concentrated in 3 municipalities. The one where I live in Ixtlahuaca, it's one of the most populated in Masawa. Okay, as they are now, as I have already mentioned, 5 of the groups, are they represented in the official discourse or in the social media? Well, let's see. In this newspaper from the state of Chiapas, so it says, Indigenous in Mexico, how to face the epidemic, discrimination, and historical abandonment in the state. So the same news, the same item of news is talking about the problems they suffer. It's an epidemic, discrimination, and also historical abandonment. So they have always been forced to live in isolation. So that's why this news, it says, the indigenous groups in the country decide to close the territory and not allow the entrance of people who are not from the community. So isolation is one of the measures to avoid the epidemic extend to their communities. So many people were saying that indigenous people are ignorant people, that they do not know how to face this. But actually, the first one who decided that isolation was the best measure to follow. And most of the people are facing, are having this. And I also have one of the testimonies from one of the indigenous people from Oaxaca, who is actually proving this, or who is testifying about this. Okay, now, and this is the news letter from a research center in Mexico, Claxo. It's Latin American social studies. And so the indigenous people in Mexico facing COVID. So in this news, so we say that indigenous people face this with lots of disadvantages respect to the rest of Mexicans. They live in a very different situations, even in their own communities, which are not really similar, which are really heterogeneous, and have reacted in a particular way as in collective in cities, more than in the cities, and they are organizing themselves in collective groups to face this situation. From the outside, you can see in Los Angeles Times, it says that people think the people which have been infected is more than 562 cases. This was in July 6th, and nowadays, well, the number I think has doubled. But they face, well, if you notice, most of them, it's about protection, government protection. But well, they do not talk about what they are doing. So it's about the government paternal, the father protection. So I am the government, so I'm going to guarantee attention and protection of the towns. And if you notice in the two previous items of news, it's completely different. So the communities decided to isolate and not to receive people from the government. They were even rejecting people from the government. Okay, because unfortunately, as you can read in this, we can see in this item of news, one of the most influential newspapers in Mexico. Unfortunately, among the indigenous peoples, some actions are and attitudes are not noticed, are far from the necessities. And they are affected by the lack of the excess of information, which is actually fake news, which have been affecting these societies, because they think that this epidemic is just a simulation, that it's a political invention with political purposes. And in the official discourse directed to a more urban population, and not to the indigenous, who do not really understand what is really happening. So with this in mind, there have been some problems in the area where I live. Some fake news have been spread, and people were reacting in a violent way, not allowing people, strange people to enter their communities, because they say, so we have our own ways of treatments, traditional treatments, traditional ways of surviving, so we don't need you. And so this has become a very dangerous situation, because you cannot go, 2 months ago, now it's becoming a bit softer. 2 months ago, you couldn't go into a specific town in the area of the Mazahuan land, because they were doing this, they were reacting violently. But some other institutions like this Universidad Intercultural in Estado de Mexico, it's providing information in their own languages. So in the Mazahuan language, in Matlatzinca, also in Mazahua, creating videos on how to create your own masks, how to wash your hands. And if you have some problems, there are some telephone lines which are helping or supporting people in their own languages. So this university is doing a great work in supporting this situation, because the government is not really, as you can see, they are just talking about bad things and dangerous things, strange things, but not really helping. So that help is providing health services, but as you can see, that's not really what they need. I really loved what Dr. Patel says, that in the communities they don't need a doctor. They need someone who is from the community and who knows the real life, the real thing in the community. So in this university, as I told you, telephone attention, constant videos showing. Well, actually, this is subtitled in Spanish because it's narrated in Masawa. And actually, this video is also showing how to create your own mask in Masawa. And the 5 languages are really represented in the institution. But actually, it's a government institution, but it's an educational institution. Well, I interviewed some people, as for example, this guy from Oaxaca, Octavio Leon. I asked how they are facing, and they told me bad and good aspects. So the bad things are in the economy. So migration has been affected because people used to work in Mexico City and the US, in the United States, and also in the border states, and they were forced to go back and to stay in town. But these people who were going back to their communities, they were not really accepted because most of the communities thought that they came from big cities and they were infected and they will infect their communities, and they were rejecting their own people. And this is what people from Oaxaca, in this case, in one of the communities, they were facing this. But good things, and as I mentioned before, the services and also the lands and the traditional ways of surviving were reactivated. So for this, the local for these guys in the Mixtecan area, local services and commerce and ancestral community activities were revived because children, instead of they were not going to school, but they were going to school, but also they were learning ancestral activities and promoting traditional medicine. Ancestral activities like going back to the forest to pick up wood, to collect herbs, and also and these things. In the state of Guerrero, I also interviewed Alan Posas, but this is most of the things are people are not convinced. That's what he said. That people are not convinced about this illness because they say, well, this disease has existed long time ago. We have suffered fever and the flu and coughs. And so we don't see that something new, but we have been using traditional and modern medicines at the same time. But what they think is that religious and agricultural rituals were canceled. And this shocked them because this is something that it had never happened before. And so this interruption of the rituals and traditions is affecting them in the psychological way because let's say we cannot live our lives as they were. So they try to do the thing as usual. So they keep the same greetings as usual and don't see it as something new. So they say, well, people die because they are old and people die because sometimes it's necessary. Well, it's part of our life. So they keep their lives in a normal day, in a normal way. Actually, the Masawa, in the area where I live, we have seen this thing. As I told you, they're not really convinced, and several people have been injured due to fake news, as in the violent reaction, which has happened more in this area of the Masawa. But also, there are good things. Again, the local economy has been activated, traditional forest and crop activities uniting families. So families go together to pick up wood or teaching the children in farming and local product collection, for example, helps mushroom and wood also in this area. And finally, I look at the Tlahuica, which is the least numerous group. They were all not convinced of COVID-19, But when several cases appeared, they started taking care of the group, because as I mentioned, they are a few people, a few speakers, and so they reactivated the local economy. They started the exchange of local products. So some people farming something, exchange it for another, and so this also forced the reduction of cost to move the local economy. So they prefer to reduce the cost of products rather than let them go off. And also in this community, the traditional activities were revived. And well, I also would like to thank you in this languages. So Poku, Hamedi, Tlasokemati, Babiti, Kwemunteño. Thank you.
Thank you, Miguel. It was a wonderful presentation, and you brought about really, this was an thoroughly empirical research, and which brought out intricacies and the minute details of what actually indigenous communities are confronting. And it's really interesting because we can see so many similarities which are happening in India. And not only in terms of segregation, which even Maria Luisa in her presentation has highlighted, that how they are being racialized, there is segregation because of the phenotype, their looks and all. Similarly, even there is an economic encroachment also which is happening. There is a very interesting, I won't even say interesting because it's a very pathetic thing which is happening right now in India, that in some of the areas where pandemic affected communities are living, there is an outright encroachment by the multinational companies which is coming under through an hidden passage. There is a very controversial thing which is happening right now in India, in one part of indigenous territory. Even though India and China are having a conflict, there is a huge land area is opened now for mining to the Chinese stakeholders. So this is controversial, and it brings out how much vulnerable the indigenous communities have become right now because of this pandemic. And another important issue which you brought about is migration and reverse migration, and how there is a rift and schism created within the communities, which is equally evident in Indian communities as well. A lot of indigenous communities are now being really antagonistic to their own people, and they are not letting their people to come inside the village, or they are treating them as like excommunicated persons. So this is something which we'll be discussing now in this panel, in this Q&A session. I just will make a brief announcement right now. Actually, a lot of people are watching us through YouTube live, who all got registered. And they cannot ask the questions because chat option is disabled in our YouTube link. I don't know why. We try to help out with technical issues. So I request all the participants who are watching us through YouTube live link, they can go to our Facebook page of Rural South Asia. I'll just show you that. If you can see Facebook page of us. So just a second. There is a Facebook page of our Rural South Asia. So if you can go to there, I can't show it there. So the participants who are watching us through YouTube link, please go to our Rural South Asia Facebook page, and there we have mentioned a post where they can post their comments, or they can directly go to Rural South Asia website where we have a comment box. There you can raise your comments, and all our students and research scholars of the Department of History who are already connected to us through WhatsApp, they can raise their question through and send to us through WhatsApp. So now I request Paramita to please comment on the two presentations, raise some discussing points of discussion. And we also request all the panelists who are right now present in this session, we look forward for your comments or any of your observations. And so please come and raise your thoughts, share your thoughts. We would really like to have a vibrant, diverse discussion on these two wonderful presentations by Maria Luisa Waisaga and Professor Miguel Reyes. Yeah, Paramita, please go ahead.
Thank you, Miguel. Thank you, Miguel Reyes. It was really a wonderful lecture, just as Maria's was. So yes, when you pointed out that there are, I think, 68 groups in Mexico, indigenous groups, and in India you told that there must be more. Yes, there are more, just it is an information, nothing else. There are 705 officially recognized tribes, indigenous tribes in India, but there are lots and lots of more Adivasis communities and groups. They are yet to be included. So official recognition is just like one thing, and there are lots of other groups also. They are yet to be recognized in that fold. So yes, that is true. And your lecture actually covered both the good and the bad sides in a very, very prudent way. So you pointed out how it is affecting the communities, and at the same time, there are some good effects also. Or something good is also coming out of this. So like in everywhere, we are seeing that the traditional practices, knowledge bases, resources, these are coming up. And the children are taking up those activities and they are learning those things. So first of all, do you believe that this is going to be a permanent change, or is this just as soon as coronavirus is getting will be erased from the face of earth and immediately the world will be as it is? Once again, that those traditional knowledge and resources, once again, they will be marginalized. So what do you think about that?
About traditional knowledge?
Yes. Is this change going to be permanent? This revival of traditional knowledge that we are having right now?
Okay, let me see if I got the question clear, because it was kind of it was not inconstant sound. Well, that something that indigenous people here treasure, it's how they have been developed. It's like so. There is one saying that says they can take the branches or they can take the trunk, but they can never take the roots. So they are they always keep always they feel attached to something which is ancestral, and so they feel as even if they live in the modern days, they consider that most of the things that they know and they do, it's because it's a heritage from some time, and that cannot be forgotten. That cannot be relegated to or to put aside. So, and I think that in these times, this traditional knowledge has been what it has. I have seen it, especially in my area where I live. Well, I don't live with my mom, but I know that my kids now are learning how to farm, and they are learning how to collect food from the forest and with their grandma. And so this well, I have seen my mom being so happy to teach this, because there had been, well, it's a long time, no one had been really interested in learning from her. And I think that she's, well, I'm going to stay at home, but I know that I am surrounded by the nature. And if someone asks me about the nature and how to learn about the nature, so she's saying, this is edible, this is, you cannot eat this, you can eat this, that plants can be used for this. And this is something that I also learned from this guy from Guerrero that I interviewed. He says that they are really worried about the rituals that they are not doing. But they say, well, diseases have been here forever, for ages. And now what we do is to combine this modernity and modern medicine. But we also have our own remedies, our own medicine. And it has worked for a long time, since long time ago. And what they think is that well, and something that I also learned from Bina, Dr. Bina, a few months ago, is that local communities have not been really affected as in the urban cities or the urban societies. So they are not really. I wouldn't say that it's not so tragic as many people think, because they know how to survive, as not in the urban areas. So I think the traditional knowledge, it's a way of surviving. Right?
That's right. That's right.
Absolutely brilliant, Miguel. Very good. That is really a very good answer. And you said it in a nutshell that yes, these traditional resources and knowledge, they are a survivor. And because we have the Savior Project right now, as Sri Patel told us about, in India we have that Savior Project. So because of that context, this question came up in my mind, because it is true that due to pandemic, these traditional resources and medicinal knowledges, they are emerging once again. And it is also true that mostly what we are seeing right now is Western medicinal systems and a more or less a centric. That is the center, that is the medicinal system, and it has to be imposed on these indigenous tribes because they cannot take care of themselves, because they are poor, they are vulnerable, they do not have access to this center medical system. We have to take it to them, and in another way, we have to impose this on them. It can be interpreted in that way also. But while you believe, I think Maria believes, I believe, and lots of other people just like us, they believe that this is a brilliant repository of knowledge, traditional resources, knowledge, herbs, plants, medicinal plants. And why don't we see it in the reverse way in these kind of situations? It is always the Western medicinal system being imposed on these tribes, on these groups. But why are we not adopting those knowledge systems, those traditional resources? And we are not seeing them being adopted in the so-called mainstream treatment protocol. Why is it so? This is the question that actually is quite tormenting me, has always tormented me. And in this context, it is more so. So I think Maria as well can answer this, and Miguel, you too, because I really believe that we have, in everywhere, every corner of the world, we have a brilliant repository of traditional knowledge and medicinal resources. We have survived long on this. So why are not seeing any reverse use of that? Why it is only one-way imposition of this, like any project what we have in any part of India or in part of world, it is always a particular centric, this Western medicine system. Actually, in another way, that is what, if I to be particular, that is what I can say, this Western system of treatment protocols. So why are not we can see the reverse thing? Why are not those systems being adopted in our projects like Savior or like any other country? Why isn't it happening? What do you think?
Well, I think that one of the main reason is that it does not make money. Because for people of a community is just helping each other. For no retribution, money retribution. and it's knowledge sharing without money retribution. It's not interesting, or that's not interest to companies, I think. There have been some interesting efforts here in the state of Mexico, especially in this university I mentioned, Intercultural University, which is starting new BAs, new life careers, which are based on traditional medicine. They actually have two BAs, Salud Intercultural, which is intercultural health, and intercultural nursing, which is based not in the modern medicine, but in traditional medicine. So they know this now, how the traditions of midwives and curing with herbs and collecting herbs and preparing their own medicines, and it is based on that. It's a pioneer in America, actually, because there isn't any other in America which has this.
The religious department here at the university, anthropology. I would say I call it, even some people call it traditional knowledge. Myself as a chemist, I call it the scientific, method from different philosophies of different lives, of different communities in different spaces.
That's right. Yeah. I fully agree to what MLB is saying. And Paramita, you rightly raised the issue of traditional knowledge. But, there is a lot of technical, constitutional, legal, economics, lots of issues are associated to it. So it itself, it's changing a lot, and there is a lot of globalization has a lot to do with what is happening with the indigenous knowledge systems, and it is all thoroughly traditional, based on the traditional knowledge systems, are actively working in India. They are certified by the government, which unfortunately in other parts of the continent are not. Especially in American continent, they are considered as only the health supplementing, the system of health supplements. So this issue has this whole traditional knowledge and how far we should allow it to be capitalized, as well as resource should be nurtured as a resource within the indigenous communities. How we are going to work on it. Actually, even though Ayush is there, still a lot of patenting is awaited for that. Because in the international global market, many of the Ayush practices are not certified and they are not globally accepted, especially by the WHO. In such a condition, how we are going to work on our traditional knowledge systems, even if they have certain kind of therapeutic efficacy. So I would really appreciate if Miguel has any more, because this is a burning issue, especially in pandemic, that how Mexico, people in Mexico, the indigenous communities in Mexico are practicing their indigenous knowledge systems to not only combat COVID or its primary symptoms, but also certain other.
I think I'm giving quality to the local communities, and the local communities we are resisting, are in a state of resistance. Okay, this is happening, but we have our ways of surviving, and so we're trying not to.
Is about anthropology and medical education.
Learning from my family, and this is what I'm going to do. Definitely, I
appreciate this viewpoint, because right now the debate which is ongoing right now, even in the traditional thought process in India, the traditional those who are working with traditional communities, and when I am talking about traditional communities, they are the grassroots people who are working with the indigenous communities, and they are saying that this is end of ideologies. Like we are in a state of affairs in academia at now that we are in the end of the ideologies. There is nothing called Marxism, colonialism, post-colonialism, or even post-nationalism. Neither decolonization, everything is in a juncture. It's in a flux state right now. And we are in a churning point where we have ideologies and their viability to the present context. Because
it's not a casualty, it's not.
Exactly.
It's not by chance. It's not by chance. And we can put all our certificates and PhDs and knowledge we have, but at this moment, goes beyond the paper, goes beyond the, I don't want to offend anybody, goes beyond the anthropology or the anthropologist or sociologist on the desk. Exactly. It's about what's going on in our own lives, our own, because we don't know what's going to happen.
Exactly, and ideologies. I would really appreciate, Miguel, if you can pitch in and say your words, because you two are the panelists for today, and we really, Miguel, are you there? Please, would appreciate your comments. So when we are talking about the whole ideological conflicts in terms of indigenous knowledge and the structural acceptance to traditional knowledge systems, so how we are going to present it and what is going to be because they have both their positive and negative approaches. So how they are going to convey the message, or how we are going to put the traditional knowledge systems or the ideology and spirituality itself in the mainstream discourse, because that is also your paper, why we are silent about indigeneity and what is going to be their say in this whole pandemic. Yeah. Please go ahead.
So where are we?
Exactly.
So where are we? Well, I think it's difficult to say. I think we are, all of us, as Maria, are together, and we don't know where we. But I think the line that is guiding us is ancestral.
To do that, so indigenous people, indigenous communities, indigenous kids, because you get lost about what happened with the economy in our own societies, so how it's going to affect that to the main societies when they realize that the disposable people are not there to harvest and seed and the crops.
Very well said. This was yeah, Professor Dr. Jean, you have some comments, but just
I want to thank Dr. MLP for her observations. I just wanted to comment on tomorrow. I'll have a few things to say about our whole notion of economy, but specifically on education, I think there are 2 points I think that are very here. I mean, there's a whole discourse about how burdensome it is for parents to have their children at home, and how are we going to educate our children. And I think there's an opportunity here.
Specific pandemic in 2020. We had one in 1820, we had that Spanish flu, and we had. So what is different now? How the indigenous tribes are coping now that is different from, are there any literature, are there any research on that? Because we have to connect the past, we have to connect it with the present so that we can know what is coming to us in the future, how they're going to cope in the future, because these pandemics are going to come back. As Sir said, the Honorable Vice Chancellor said, history repeats itself. It is in the past. Is it very much different from how they are coping today?
About this, and that's what I'm seeing. The other thing I'm seeing is they are bringing up the old methods of storing seeds. I'm talking about the Andes. It's cold, it's dry. How to store seeds, how to change seeds. What do you have? I have this, and I have that. Even for me, I realize me living here completely I have my ticket and I decided to be going next week because the rites are coming, the ceremonies are coming, and I stay here. And my mom says, when you are coming, said, Mom, now we are in lockdown. And then I realized that myself here at home, I have seats. So these are the things I learned, like my mom always said, you need to have seats for everybody because you never know. Yeah, Mom, whatever, I just go to the supermarket. But at that moment, I went to my box of seeds, wrapped in paper, with their name, when I collect them, from where I collect them, and they are there. And I took, and I made some things for me and friends. And these are traditional knowledge, like you learn from your environment. So this is what I learned. And then I have all these questions, what's going to happen with this and that and that and that and that and that. But I think that's conversation for another. Very much. I really, really, really appreciate this dialogue because we need to we need to touch about the mystical to the concrete, what's going on right now and what's going to happen. What's going to happen, I don't know. I hope, help will come and we can go outside and, hug each other or, different ways. In the meantime, keep safe. Thank you very much. Thank you, Bina. Thank you, the university. I really, I'm honored to be here.
Miguel, anything from you? Closing thoughts, and then I will close my. Then I'll say.
I'm really moved by Maria Luisa's words, and I also learned a lot. I am really pleased to be invited and honored to be here, sharing something of my surroundings, of what I've learned, what I learned today. I appreciate all your comments, your words. Your invitation, even in the distance, it feels like presence.
True.
Thank you very much.
It's a pleasure to. Paramita, would you like to? After that, I'll close everything. I'll mention the closing remarks.
Yeah, actually, it was wonderful. This session, it has been really wonderful, Maria, Miguel. So beautifully, just you have covered everything that is important. And Jean, even for 5 minutes, what you said, it was also very much enlightening for this session. And Professor Whiteman, it was just absolutely just beautiful what you said about. And I personally, I will be looking forward to the book that has been is about to be published. So everyone, this session is really, and all of us have been agreeing on that it has been a really enlightening session, enriching for all of us. So I agree. I cannot just less agree with this. So thank you. And I am honored to act as a discussant in this session. So I'm really honored. Thank you. Thank you, Miguel. Thank you, Maria. Thank you, Professor Weidman. Thank you, Jane.
Thanks a lot. Thanks a lot, Paramita, for summing words from both Maria Luisa Vaisaga and Miguel. It was truly an honor and a pleasure to reconnect with good friends. We had some really timely discussions, not only now, but even in the past. We had been brainstorming about the vulnerability and the silence which has been given, which has been posted on us, on the indigenous communities all over the world, where the dictating terms are being decided somewhere. I really remember a beautiful lecture by Arundhati Roy at this time, when she said that nobody knows who is in UN, nobody knows who is in WHO, because nobody is elected there. Everybody is nominated, everybody is appointed. And how the networking takes place over there doesn't really qualifies that who is representing whom. And somewhere God is seeing everything, and he is going to bring that small thing to change the entire discourse. Perhaps this pandemic with this small non-living coronavirus is that small God which has come back and is challenging all the discourse and talking about this whole end of ideologies. So as Paramita already stated, we are not going to end here because this is an ongoing discourse, which perhaps we will try to develop in some other platform because we all have our own preoccupations. So we may not be able to do every time in this Google Meet, although we would love to have you all in India so that we can actually go in some indigenous land and work with the communities and do justice to their presence, because we have to bridge several divides. So I hope this COVID will give us in future some window to at least come in interpersonal discourse, not only in just virtual platform, so that we can continue this discourse. I once again thank everybody. I'll thank from the top authorities. I first of all thank our Honorable Vice Chancellor, sir, who gave us not only the permission to do this seminar, but also took time from his busy schedule and came to deliver his point of views, which were thoroughly discussed. And I also thank our chair, Professor Umesh Bagade, sir, who came to the session and inaugurated this session. I thank all the different panelists who are there for the coming 2 days. And deep, heartfelt thanks to both Maria Luisa Vaisaga and Miguel Reyes, because without you two, this thing could have not seen this beautiful session happen at all. Your insights were valuable and your comments